Good afternoon, everyone.
Good
Welcome.
afternoon, everyone.
Welcome to Facebook Live session from Dr. Makkar's Diabetes and Obesity Center. I'm Dr. Kirti. So today we will be discussing about latest technologies in the management of diabetes. Technologies in diabetes management has come a long way from blood glucose meters to CGM, insulin pen to insulin pumps, and much more. These newer devices are easier to use and less invasive. Optimization of glycemic control has shown to reduce complications, and technologies are evolving to offer more precise treatment. They are offering solutions to overcome frequently encountered barriers and empower people living with diabetes. But technologies can also prove to be a burden if not properly used. So, dear friends, it's time to know what is the best for you. Welcome, sir.
Thank you, Dr. Kirti.
Sir, we would like to start with the first question regarding choosing the right glucometer. Glucometer as such is a part of life of every patient suffering with diabetes. We would like to know more about the new developments in the glucometers.
So again, it is very important and relevant. First thing is, it's way back in 2005 that International Diabetes Federation came out with the clinical practice recommendations recommending the availability of glucose test meter for every person with diabetes. So it is recommended that every person with diabetes, whether it is type 1 or type 2, should have a glucometer. Now, unfortunately, India, there are multiple reasons why we don't have that practice of advising glucometer to everyone or everyone using a glucometer. That is largely missing. And unfortunately, very small number of people with diabetes use glucometer regularly to test their own glucose values and keep it under control. So it is one of the reasons why people are largely not controlled in India. Where our uncontrolled percentage is higher than the global percentage. Only about 30% of people with diabetes achieve good glucose control on an average. Now, glucose meter is something like, what should I say? So, can you drive blindly?
Pardon, sir?
Can you drive with blindfold?
No,
You
sir,
can't drive.
not at all.
So this is, treating blood glucose levels without using a glucose meter and without regularly testing where the glucose levels are going. It is like driving on a road with your eyes closed. You are taking medication, you are taking precautions, you may be very good with diet, exercise, but you don't know what your glucose levels are. And you don't know what is the impact of whatever you are doing on your glucose levels. So it is like, if you're not using a glucometer, it is like driving blindfold on a busy street and you are very much in for an accident. So knowing your glucose values is as important as, opening your eyes to see anything. Can you see anything with closed eyes? No. So you cannot know your glucose levels unless you test them. People will come and tell, that डॉक्टर साहब मुझे पता चल जाता है मेरा शुगर जब बढ़ जाता है या कम हो जाता है पता चलता है समझ आता है because hypoglycemia has its symptoms. High glucose values, moderately high glucose values, there are no symptoms. And majority of people with type 2 diabetes do not get any symptoms because of high glucose. So there is no way of knowing, what your glucose levels are unless you test glucose. Now, when you are taking a glucometer, there are multiple challenges. Now, there are, I think, more than 100 brands of glucose meters available in the market. So, there are very clear-cut regulatory, regulations that tell you what glucometers you should buy. So all the glucose meter that are standardized should conform to ISO 2013 standards recommendation. And you can check on glucose meter whether it is conforming to the ISO 2013 standards or not. Second thing is, you should, people try to compromise on the cost of glucometer, but I think this is the thing which you should buy as best option. And the cost difference between the cheaper or the best glucometers is not very significant. But if you are not having a good glucose meter and you can't trust the readings given by the glucose meter, then you cannot control your glucose well. So it is very important not only to have a glucose meter, but to have a good glucose meter, or rather the best possible glucose meter, which gives you an accurate value of glucose, so that you can make a decision whether you need to change treatment, change diet pattern, change exercise, whatever. So it is very important tool that every diabetes person should have, and should have a standardized best possible glucose meter for self-care.
So can you please throw light on the glucometers which are new in the market, which say it's no blood, no prick?
Yeah, so other issue that comes with glucose meters is that people are, they avoid pricking the finger. So now what we use pricking devices, so-called the insulet pens, they have a very sharp, lancet inside them, which is not visible. So person cannot see the needle. All person has to do is put the pen tip on a finger tip and just press the button, and it will stab and create a blood drop. And they are so thin, and the requirement for blood with the new glucose meters is very small. So something like 5 microliter is the drop size that is required to test blood glucose, which is almost 10 times or 10% of what used to be required or more. So a very small amount of blood is required. Finer lancets are there. Pain is very less. So you can, and if you don't have to do it frequently, you can use that. But recently there are glucose meters which have become available, that you don't need any pricking of the finger, and you can test glucose. And there is another option which has become available, is the continuous glucose sensors. So you can apply a sensor on the back of arm, and you have a, you can say decoder or controller, which by simply swiping or taking it closer to sensor, you can read what is the glucose value at that point of time. Now, drawback of these things is that they are quite expensive. They're quite expensive. Second thing is, not everybody needs to test 10 times or 20 times every day. So you don't need these devices. If you are well controlled, maybe testing 4 to 7 times a week will also be very good. If you're not controlled, yes, you have to test frequently, and you should test as frequently as advised by your treating physician, till you achieve a good glycemic control or good glucose control. So testing is important. The finger pricking or the needle stabbing you can avoid by using the newer devices which have become available, but the cost is high.
सर अगर हम बात करते हैं CGM की, कॉस्ट फैक्टर को अपार्ट रखते हुए, तो क्या आप ये बता सकते हैं कि कौन से कैंडिडेट्स वो होते हैं जिनमें CGM इम्पोर्टेंट है या उसका एक रोल होता है?
So सबसे इम्पोर्टेंट चीज है CGM, बेसिकली जो टर्म यूज करते हैं हम कॉन्टिन्यूस ग्लूकोज मॉनिटरिंग के लेकर. कॉन्टिन्यूस ये भी नहीं होता है, बिकॉज द सेंसर इज रीडिंग एट इंटरवल्स ऑफ 5 to 15 minutes. So sensor is not continuously reading the glucose. The time interval between two readings is anything between 5 to 15 minutes. So it is phased, but it is more or less continuous, and you can get anything between 96 to 288 values per 24 hours. Now, somebody who has type 1 diabetes, where you need to give 3 to 4 times of insulin injection every day, and you know that there are large fluctuations happening in response to meals or exercise, and especially type 1 usually happens in children. And children, they have, you can't control their lifestyle very much. So there you need to test frequently. And usual recommended frequency is about 7 times a day. So these are people who actually do very well with the continuous glucose monitoring, because all you need to do is apply a sensor once in 7 to 14 days time, and you can keep checking their sugar. Even if you want to check 100 times a day, you can do it. But you don't need to make an extra stab on the finger to test glucose. Suppose the child has to go for a birthday party. You can't tell him or her not to go to friend's birthday party. You want to make sure that child is having, a decent glucose level before going, whether child needs additional dose of insulin before going. So all you need to do is just flash it, swipe it over the sensor, and the controller will give you the value. And you can decide whether you need to give some extra insulin to the child, or tell him or her to take some precautions when, at the party, and so on.
So to add on, these CGM devices are so easy to use that they can be applied by themselves also, and
Yes.
they can be managed very well.
So patients or patients' caregivers, family members, support people, they can be trained to, apply the sensors themselves. It is not difficult. It is not difficult at all.
So is CGM okay for a GDM patient?
So gestational diabetes is a situation where we want very strict control. See, gestational diabetes, for everybody's information, means diabetes during pregnancy. Now, this can be pre-existing diabetes, or this can be a diabetes which is new onset during pregnancy. A pregnancy is a critical phase where you want to maintain glucose levels in a narrow range to make sure that you have good outcomes for both mother as well as baby. So gestational diabetes is a situation where two lives are affected, right? And providing a good glucose control actually improves health outcomes for both mother as well as baby. It is not just the delivery part of the baby. A good glucose control during pregnancy, it reduces the risk of having, overweight, obesity, multiple problems in baby during the later parts of life. If the glucose control is poorer, or there is higher degree of insulin, there is chances of getting, premature births, childhood obesity, adolescent obesity, early onset of diabetes, increased risk of blood pressure. So many things can happen in baby also. So providing a good glucose control during the pregnancy period is very, very important. And certainly CGM can be very helpful in monitoring the glucose during that time, because we want everyone to monitor at least 4 to 7 times daily during that period. And second thing is, it is a limited period. The most of the ladies who will develop diabetes do it after 20 weeks of 24 weeks of pregnancy. So almost half of it is already gone. So you need to do the good control or good monitoring only for 3 to 4 months, which is very much doable, and it is cost effective also.
So this was about the monitoring of blood glucose levels. So next point, which is very important, is the testing. Let's talk about the lab testing and the point of care testing, which we are very particular about these days.
Yeah. So as we were talking, that we need to monitor glucose. So this can be done at home by the patient, right? Or somebody at home can monitor for the patient. They can do the finger stabbing and regulating. Now, another important thing is the new blood glucose monitors. They have connected apps in the phones. So once you do the blood test, automatically your telephone also records that blood glucose value, and it populates a table. So later on, whenever you are visiting your physician, you can just take out the report for last 2 weeks, 4 weeks, whatever tests you have done, at whatever times, and it will show what was out of range, what was in the range, what was going above the range, below the range. So all these things are doable with connected apps, and all these new glucometers from best companies, they have connected apps now, and they help you in deciding when treatment is required to change, and so many things. So that is one plus point with the newer glucometers. Now, this was the self monitor, but diabetes management is beyond glucose testing. All type 2 diabetes patients and all type 1 diabetes patients also are at risk of developing long-term complications. So there are two major sets of complications, microvascular and macrovascular, and you have to see that if you are keeping the A1C level, which is the glycosylated hemoglobin level, less than 7%, the risk of complications is significantly reduced. Now, what is A1C? A1C is a glycosylated form of hemoglobin. What is glycosylated form of hemoglobin? So once the glucose is circulating in blood, it it damages all the proteins when the glucose levels start going up. So similarly, it damages the hemoglobin in red blood cells, which can be easily measured as a glycosylated hemoglobin. So as long as the glucose levels are within the control range or target range of say about 100 to 140 in an individual, the A1C levels will remain less than 6.5 or so. If the A1C levels are up to 7%, the risk of complications is significantly low. But after that, it has increased. And as the A1C goes up, there is a significant increase in the risk of complications. Now, suppose somebody comes to the clinic for a visit and you want to see A1C. Now, what option you have? You send the person to lab, get the report next day and call the person next day, or talk to them on phone. You can't decide whether you need to change treatment or not. And here, unfortunately, in India, people don't come to visit on a predefined time, right? Because everybody has to pay out of pocket. So the regularity of visits is poor. So many times patient will come who is not even testing his glucose. We don't know the average glucose level. Now what I have to do is I have to either tell the patient to go home, test again, get the test done, come again. Lot of money wasted for repeat travel, repeat visits, lot of time wasted and so on, because I can't take a decision. Now same facility, if I'm using it as a point of care testing, all I need to do is do a fingerprint prick test for A1C. 5 minutes I know that A1C is normal. So largely this patient is doing fine. I know how to manage it. If the A1C is high, I know what next step should be. But then this can give me immediate answer and it can help me in making a decision, avoid a repeat visit if it is avoidable, or plan the next line of action as far as the treatment decision is concerned. Similarly, now there are meters available for testing lipid profile. So you want to check lipid profile. Now there is no need to check empty stomach or fasting lipid profiles. Most, large number of labs still stick to that practice of getting a fasting sample. Now you don't realize that to get a fasting sample, first patient has to go home. Second, if he is a working person, it is unlikely that he will be able to reach a lab in the fasting state before he has to go to work. So it is generally, lingering on and it is delayed. Third thing is, you have to go to lab first, give the sample, collect the report, come for a repeat visit. This all can be avoided. You don't need to do a fasting sample. Do a non-fasting lipid profile. You can do it with a finger prick. You can know all the lipid reports right at point of care, and you can take a decision what is to be changed. Right? So, and you should know, only thing is you should know whether you are doing a fasting lipid or non-fasting lipid. For non-fasting lipid, the cutoff for triglyceride level is slightly higher. That is all. Similarly, if there is a doubt on kidney function, you can do it with a finger prick in your clinic practice. You can check urine microalbumin in clinical practice. So there are so many things that you can do at point of care, which help in deciding that treatment needs to change or no. Second thing is to test for complications. Again, there are devices available which tell you instantly whether this person has a damage to nerve, or the circulation is getting compromised, or simple fundus camera can tell you, give you an image inside the eye, and you can take a call whether there is significant damage to the eyes or no, and accordingly you can plan the treatment strategy. So nowadays you don't need to actually uh, and every patient who's coming to you for a clinic visit, most of the people have to come on working days, so they have to lose their work, right? They are losing their work, they have to take a holiday, and if you put them for another day for lab or further workup, they have to lose another day. But if you have adequate good point of care testing machines, and you have facility for evaluating the microvascular complications, everything can be done in one go. You can make a decision that okay, this patient has this is the glucose value, this is A1C, this is lipid profile, kidney function. You can test for the nerves, blood circulation, fundus, and you can decide now this is the final line of treatment, send the patient home. But this is very much doable with the availability of newer technologies now. It is not difficult at all. And in fact, the glucose meters now connect with the centralized software, which is loaded in the doctor's chamber or laptop. So even once the person is testing the glucose values, they automatically can integrate with the your treating physician's software. Also, similarly, there are blood pressure monitors which communicate with the phone app. There are weighing scales now which can communicate with the app in the phone. So whatever you are monitoring can get transferred to a app which gives a comprehensive value of say 7 days, 14 days, and whenever you are visiting the doctor, all the readings are with you. So there are so many things which have evolved with technology that can be used to improve care and simplify care. That is more important.
So basic aim is to improve the patient care.
Yes. And
Perfect.
provide comprehensive care without complicating the lifestyle or the treatment strategies.
And through these technologies, sir, to some extent, we can empower the patient also, what I feel.
Absolutely. Patient gets fully empowered with these. Patient knows, patient can check sugar at home. Patient can monitor glucose all the time at home. Patient can easily check blood pressure at home. Weighing is fine. So if the person is maintaining decent glucose values, decent pulse rates, most of the time when you check blood pressure, pulse rate is also reflected on the meter. So you know what is going on. And most of the time you know that you are doing fine or you are not doing.
So we have discussed about the monitoring of blood sugars. We have discussed about the testing devices and what tests we should be doing for the patients. Now coming next to the treatment part. So till date, what we are seeing is people are using syringes for their insulin injections. But we have smart devices available. So we would like you to discuss about those things.
Yeah. So conventionally, we have been using, insulin syringes, but now I think it is more than 15 years that we have been using pens or injectors, or maybe 2 decades. And using insulin pens actually changes the whole scenario. For a syringe to be used, you need to first withdraw the insulin into the syringe, make sure that air bubble is removed. You have to make sure that you are using accurate amount that is required to be drawn, and then inject. Okay. And the needle size is longer. Usually with the syringe it is 8 mm, while the needle size in the pen needle is about 4 to 5 mm. So you can do with smaller needle with the pen. Second thing is, every time you need to withdraw, ideally the syringes that we get are disposable, so that adds to the cost of treatment. Third thing is accuracy. There are a lot of people with diabetes who have compromised with the vision. So measuring the insulin accurately and injecting accurately becomes little cumbersome, right? Injecting with a pen device is much more easier than injecting with a syringe. So you may not be able to inject properly with syringe, but injecting with pen, it has its own inbuilt mechanisms, uh, making sure that you are injecting the right amount and it will get locked once the insulin is delivered and so on. Third thing is the needle that is used is thin and short. So the pain with the pen syringes, pen needles is much less as compared to the syringe needle. Fourth thing is the pen, every pen has its, compatible cartridge, which is the actually the something like a vial which contains insulin, but it is shaped, which is fitted with the, which can fit only into that pen, or the pen has a disposable insulin cartridge, which is once you finish insulin, you have to throw the pen. It's a disposable pen. So there is no mismatch in, use of the strength of insulin and the device. But unfortunately, that is not the state with the syringe. In the vials, the insulin vials, there are two different strengths of insulin available: 40 units per ml and 100 units per ml. And the color coding for two different, syringes is also different. 40 IU syringes red colored and 100 IU syringes orange colored. Now, most of the time, people, the physicians don't have time to explain all these things. And this leads to errors for injection. Somebody using a 40 IU insulin, 40 units per ml insulin, injects with 100 IU per ml, will get only 40% of the dose, because the insulin contains 40 units per ml, but the syringe is drawing 1 ml according to 100 units per ml, right? Now, if you make the situation other way, you use the 100 IU insulin and you use 40 IU syringe, you will inject 2.5 times the insulin, and patient can get into severe hypoglycemia. So this, matching the syringe and vial and insulin, all these things become very, very important. But when you are using pen, it is a standard thing. And if you're disposable pen, there is no problem. You can easily inject. Even with visual compromise, there is a clicking sound with every unit, that is injected. So once you have to dial a dose, even if you can't see the number on the pen, how many units you are dialing, you can count the clicks. So you want to inject 10 units, you rotate the dialer and count 10 clicks, you will be at 10 units. Then there are pens which have, lens over the number read, where the number is displayed. So the number gets enlarged and you can read it despite visual compromise. So these things give you, multiple advantages. Third thing is there is accuracy. You are not looking at the cartridge when you are filling insulin. Insulin is already there in the cartridge. And you have decided you will take 10 units, you dial 10. Now device is programmed to dial only 10 units. There is no dosing error. So all these things are big advantage with insulin pens. And now we have injecting devices, injectors are there, though they are not very popular because of cost and other issues. And of course, then there are insulin pumps. So people, especially the children who need 4 times or 6 times insulin every day, they can be given, advised the insulin pump. And what insulin pump is like a small pager, which is can be worn on a sling or belt, and there is small tubing which connects to the cannula, which is placed under the skin, and it is continuously injecting insulin. Now there are two types of pumps. One is that you program the pump to give X amount of insulin per minute or per hour. It is a programmed device, and continuously person is getting insulin. And then with every meal, you can tell the patient to, take, by press of button, take so much insulin extra. So there is a continuous insulin being given, which is the total requirement, which is programmed according to the body needs, and additional needs for food. Again, person can inject extra. Similarly, this is the pump which is manually done. But now we have pumps which is called closed loop system. So you have a continuous glucose monitoring sensor placed on on the abdominal wall or over the skin at particular point, and there is a glucose pump which is connected, and this sensor is sending all the messages to the pump. So pump is getting the glucose values on continuous basis, and you can program the pump, and pump will also display what is the glucose value which you are seeing, right? And you can program the pump to keep, say, glucose value in the range of 90 to 140. So there is something called suspend function. As the glucose value goes towards 90, the insulin infusion will stop. So it will suspend insulin delivery. And once the glucose levels come back in that range, you can again activate the pump and start insulin injection. Similarly, when it is going high, it will give you a beep once it is going above the range, and you can increase the insulin dose to keep it down. The closed loop system now we have with artificial intelligence. So pump gets programmed to understand that if the glucose level is going so much, then so much insulin is required. So for X amount of glucose, Y amount of insulin is required. So if X plus 5 is happening, Y plus 0.5 will happen at the insulin delivery level. This is based on the AI algorithm. So pump is reading in glucose levels, changing the insulin dosing, and infusing at a differential rate depending on the glucose value. So a lot of artificial intelligence has been, now utilized to program these pumps or delivery devices. So all these things are now available. Only thing is cost is there with the newer technologies, but in due course the cost will also come down, and I'm sure we'll see more and more use for this. In fact, now we have disposable insulin pumps also which are available. So that's how the technology is changing, from monitoring to point of care testing to insulin delivery to devices and so many things. And it is not just the devices. The insulins we used, that currently is the 100 years of insulin also. We have completed 100 years of insulin the discovery. So the initial insulin that we used to have only 10 units in per ml, and the batch used to be calibrated every time, and the impurity level was 50,000 parts per million. Currently we are able to get insulin as 100 units per ml, so the amount to be injected is 10% less, and the impurity level is less than 5 parts per million compared to 50,000 parts per million. Then earlier we used to have only one variety of insulin. Now we have insulins which are customized, which are designed to give a desirable effect. So they are called designer insulins, which we are using now, the analog insulin. The insulin antibodies or insulin allergies which used to be there have become virtually non-existent with the newer insulin. So technology is playing role at multiple levels.
Actually, if we talk about living with any chronic condition, it's a little tough. And through this technology usage, we can reduce the barriers basically.
Definitely, with use of newer technologies, if one can afford, if the cost, because India, unfortunately, insurance doesn't cover the outdoor care for diabetes. Outside India, in European countries, in US, there is coverage for diabetes care. So people get pumped as part of insurance. People get disposables as part of insurance. All type 1 diabetes are being advised pumps given by national health system in UK and Europe. So all these things are becoming they are frequently used there. India also we will see more usage for these things, but with use of technologies we can certainly empower patients, help them achieve better glucose controls, help them prevent complications, and have a better quality of life.
So we have few questions. Can I take?
Yes, why not?
So is there any simple device to measure HbA1c for patients at home?
No, we don't. No, say people can have that same device used at home, but it is not worthwhile because it is the device is quite expensive. But it is simple. You need to do with a finger stick test. You can do it.
So another very important question, which is very confusing for the patients, is can a lancet be repeatedly used?
So before I go to that, second thing, whenever we are using a point of care device or home care device, we have to also comprehend why we are using. So glucose meter at home usage is very important because you need to check your glucose every day or every second day. But for A1C testing, you don't need to test it every day. You need to test once in 3 months. And if you are well controlled, you need to test only once in 6 months. So you don't need a device for home care here, right? Glucose meter is important, blood pressure monitor is important, weighing scale is important, but A1C testing at home is not required. So it can be done at the point of care at the clinic that you are visiting. Second thing is repeated use of lancet actually is not advisable. All these things, whether it is syringes or needles or lancets, they are one use disposable what should I say, these are not devices, actually these are components of devices, and they are one use, they are disposable. But this is the recommendation, this is ideal. But what is happening, a lot of people keep using lancets repeatedly, they keep using the syringe needles or the pen needles repeatedly. Yes, we understand cost is a constraint in Indian setting. If the needle gets damaged, all these needles have coating which keeps them free of infection also, and which makes them smooth for injection. So with repeated injections, these tips get damaged, so they become more painful, and they will cause more damage to skin, which is not visible because it's very small thin tips, still they are damaged. So the pain will become more, and the chances of infection will also increase with repeated usage. But yes, people use it, but we don't recommend more than 3 usage for the pen needle. And for lancets, again, don't use it more than 2 to 3 times. Especially if it causes pain, then immediately change. Second thing is syringe needle or lancet, or for that matter, glucometer also, or the insulin pen also. If there are 2 persons at home with diabetes, both should have different pens, different lancets, different glucometers, different set of gadgets. Same gadget should not be used for 2 persons.
Another very important question by a viewer is which finger should be used for pricking?
See, best is to use a finger which you don't commonly use for work. So it's best to do it on left hand, and you can do it on middle finger or ring finger, which is not used for holding anything. Most of the time when you are holding something, you will use first thumb, first finger, and middle finger. Ring finger and little finger, they are not part of grip, right? So same, and if you're doing with left hand, from the left hand, you are using these fingers less. If you are a left-handed person, use pricking on right hand. In any case, when you are doing self, if you are a right-handed person, you will use the lancet pricker pen with right hand, so you have to do it on left hand. Second thing is, when you are pricking, normally what the tendency is to prick on the fingertip, in front of the fingertip, right? So here usually the skin is also thicker, and this is the part which will be used when you are picking up something or touching something. If you test on the side, you get blood easily because the skin's hair is slightly thinner. And second thing, you are not, when you are touching here, it is the prick has happened on side, so it doesn't pain much. So it's better to do it on the non-dominant hand, on the fingers that are less commonly involved in routine functioning, on the side of the fingers, not on the front of the fingertips.
Sir, any other point you would like to add more to the session today?
I think we have discussed most of the things, and most of the important points we have highlighted. And in case there are any questions, people are free to post on our first Facebook page. We keep discussing them repeatedly. In fact, we keep getting ideas what people want to know more, and we try to cover them. But I think we have touched upon most of the important things that people need to know. And of course, we will come with more and more ideas and more information on in future sessions.
Sir, we have few requests.
Yes.
पहला हमें सेशन हिंदी में चाहिए.
So
we
वो भी
will
कर
try.
सकते हैं. We will try to do it in hybrid mode. Hybrid mode is the most popular now. So we will do English Hindi combined. That is not a problem. We started doing some sessions we did in Hindi, but then we had viewers from different parts of country or other side outside country also who wanted English.
Yes.
So we came back to English, but we can do it in a hybrid mode. And what we can also do is that we can keep repeating the sessions in different language. We know only 2 languages.
I think that will be good, sir.
Yeah, that can be done.
Sir, another thing, Holi is approaching. So we have requests to make this Holi festival special for us, for
Certainly we
diabetes
can do.
people.
Definitely. So Holi and diabetes will keep a session.
And they want
Especially
recipes.
celebrating Holi.
Yes.
Celebrating Holi.
Especially with gujia, dahi bhalla and thandai.
Whatever, we can do it.
So, sir, what we are planning for the next session is to make this a Holi special session for persons suffering with diabetes, and we'll be bringing recipes for the patients, which will be diabetes-friendly recipes.
Good. I think that can be a good thing, and people can enjoy. As we have earlier also mentioned, all people with diabetes should enjoy all festivals, and they can do it definitely. Only thing is they just need to keep some precautions in mind. That's it.
But sir, there will be a twist this time. We will be having a chef.
Great. Very nice.
Perfect, sir. So, sir, that brings to the end of this session. Thank you everyone for joining.
Thank you. Thank you everyone. And let's hope to see you all just before Holi. Thank you.